Hello and welcome to IOL in a Nutshell, a series of bite-sized episodes of experienced healthcare professionals sharing their best tips and advice on a range of IOL topics to help you make a difference in your hospital. First off, we need to share a quick disclaimer as the information provided by participants is based on their clinical experience and judgment and may not be endorsed by Medicem Technology, who are the manufacturers of Dilapan-S. Today's topic is about collecting and auditing patient feedback following induction of labour. Patient-centred care is at the heart of the role of a midwife, and gathering feedback on patient experience is crucial in improving quality of care. The content of this episode is brought to you from a Dilapan-S peer-sharing event where midwives and obstetricians come together to share ideas and advice on a variety of induction of labour-related topics. Today they'll be discussing practical methods of collecting feedback, key considerations, and how to ensure the voices of the women and birthing people are heard and valued. So let's get into it.
So as I mentioned, first section, we're going to be talking about sort of patient feedback and auditing. So really want to pose the question to everybody, how at the moment are you collecting and auditing your patient feedback? Rasheen, would you mind starting off the conversation?
Yeah, absolutely. We have friends and family testing, which we get people to fill out when they've been in for antenatal care, postnatal care, etc. And they often will feedback about their inductions through use of Dilapan. We use Dilapan with normally greater than 50% of our inductions. Obviously, it varies kind of each month and people's preference and things. But yeah, we have quite a high uptake of Dilapan, and it's proven quite successful through our audit, and patients seem to be quite happy with it.
Lovely. Have you had any challenges when collecting that patient feedback at all?
Not really about Dilapan, just in general. Some people just don't want to fill out feedback, but no, in regards to kind of our responses regarding Dilapan, not a lot of problems really, no.
And Lauren, is that similar with your unit, or is there a different way that you're collecting your patient feedback and auditing?
I know that when we first introduced Dilapan a while ago, we did kind of paper feedback that we were giving directly to the patients after they had received the Dilapan. But now it's well integrated, and all apart from maybe the odd few are having Dilapan. We still have Prostin available to give if needed, but as first line, we're always giving Dilapan. So now that it's so well integrated, we're not doing the direct kind of patient feedback, but we still do gather feedback through like our friends and family and MVP.
Perfect. And seeing as you've been using it for a while, sort of what feedback were you initially getting from the women when you first introduced it?
I feel like maybe the feedback from women echoed that of the staff, in that because perhaps maybe the insertion of Dilapan was taking a bit longer because staff were getting used to the process. Perhaps maybe their comfort levels and their initial experience of having the Dilapan wasn't as great, and maybe around like the confidence in our processes. So because we were still teaching our staff of when we're putting it in, how successful it is and when it's coming out, that wasn't always echoed in confidence to the women. But now, like I say, because it's so well integrated, I think it's just the norm here. We don't seem to get that feedback. Yeah, I'd say it was mostly the comfort level of when it was being inserted that we initially struggled with.
Perfect. That's really great insight. Thank you so much. Vicky, have you got anything to add in terms of sort of collecting patient feedback and auditing that?
I don't have any sort of direct contact with any of the auditing process with the induction of labour, I have to say, because I obviously work in education. I did actually ask for our recent statistics earlier this week with the lead for induction of labour, and she hasn't come back to me. I've only got the statistics from over about a year ago. Just from, obviously, I still work clinically as well with On Labour Suite, and we still obviously use ProPairs. We probably use ProPairs more than we use Dilapan, to be honest, because we've been using ProPairs for such a long time. When we have women that are coming in for induction of labours, even though they're given the choice and the information, they tend to go with what they're familiar with, especially if they've been induced previously. Again, with Lauren, very much with the same issues when we first started about people's confidence of actually inserting Dilapan, and I think where it's sometimes being misinserted in the fact it hasn't gone properly through the cervix, because when it's been removed, we've had some cases where the internal os hasn't opened, and it's made the actual cervix sort of funnel a little bit. But yeah, I wouldn't say it's the first choice in Nottingham. I think with staff still, with the women, we still tend to more favour towards ProPairs.
Lauren, you've got your hand raised. Did you want to add something to that?
Yeah, I just wanted to go off the back of what Vicky said with it being the first choice. So when we first introduced Dilapan, we would give women a choice as to whether they wanted Propess, Prostin or Dilapan. And I always found that they were favouring the Propess and the Prostin. And I think that was because of the way we were selling it and because we weren't being confident in the way we were talking about Dilapan. I felt that the preferred option, particularly for multips who had been induced before, they were picking the medicated route. And then a decision was made that actually Dilapan was just going to become our first line induction method, and we would only be using prostaglandins as like a backup for when Dilapan hadn't worked for a patient. So yeah, I think since we changed our policy of induction of labour, that's when we saw a real big shift in staff attitude and patient attitude of using Dilapan. But I know that obviously the decision of that comes from, the powers above, but it's just interesting.
Thank you, Lauren. Amy, did you have something to add as well or ask?
It was just to ask Lauren, actually, what made your trust change to that being the first line against like Propess and Prostin?
Not going to lie, I'm not the best person to answer that. I was a core member of the antenatal team, just band 6 rotational midwife, and then I came into practice development. I know our ward manager, Bob Jackson, is trying to get onto the call, but she's currently working clinically. So as and when Bob comes on, I will certainly get her to answer that for you.
Amazing, thank you. Yeah, because we're using Dilapan for years, but our uptake of it is it's still not great. It only sits at probably like 8 to 9 women a month, and we are a smaller trust, but we're 2,500 births a year, but that's not very many of our inductions a month at all. And we're really struggling. We are training more midwives, which is helping, and we're going to put it on a study day as well. So we're having lots of study days now, but having a slot for Dilapan on there to try and help improve people's sort of opinion of it almost. I think the same thing happened with us. It came in sort of around COVID, we brought it in, and it just, the doctors weren't inserting it correctly. It was just sitting in the vagina doing absolutely nothing. And now there's a really bad opinion of Dilapan within the unit. So I just wondered if there was what was the rationale for changing it to the first line?
I missed who put their hand up first. Rasheen, maybe?
Yeah, I just wanted to add, because ours is kind of our frontline choice of induction, and because it can be used with a lot of women, so like VBACs and stuff, obviously it's safer in that respect. But we have champions of Dilapan, so in different areas we'll have some on labour ward and we have some on our antenatal ward as well, so that if you aren't certain how to put it in or you're not quite so confident, there's normally somebody else that's pretty happy to do it. The ward managers as well are Dilapan champions, but also our doctors are really good. So if we can't get them in kind of with a speculum on a normal bed, that we'll transfer women to labour ward and get them into like a lithotomy position, which is a lot easier to insert them, and the doctors will often put them in for us. So we have quite a good uptake, and they do work. From our audits, they work really well. So I think just for safety and the lack of kind of risk of hyperstimulation and stuff, it works quite well.
And Annie, did you have something to ask as well?
Hey, yes, Shelley, as you know, I could talk about it for ages with everything at the minute that's been going on with us. But I'm really keen to. We only bought it in, I'd say about maybe 3 months ago. Was it Shelley? 3 or 4 months ago? And I am trying to get patient feedback, which we've got our friends and family test, but it's not specific for Dilapan, and we don't get much feedback on it. So we did have the information leaflets that we were giving out that was provided by yourself, Shelley, but I'm not sure if we've had much feedback from that. I don't know whether you could share that with me afterwards, maybe via email, if we've had any. But I tried putting the QR codes out on the postnatal ward, but just a real lack of engagement of giving the feedback. We're actually looking into now sending out surveys to anybody that's had it over the last couple of months to get their feedback, because Dilapan is currently on hold in our trust.
Yeah, sending out surveys can be quite helpful. A hospital that's not on the call at the moment, so I won't mention the name, that was essentially what they did in order to actually collect some patient feedback. Because as you said, on postnatal ward, sometimes mum isn't really in the mood to be doing a survey or anything like that. So sometimes if you give her a couple of weeks, it means that you can actually get a little bit more information. So I know that there have been hospitals that have actually gone out of their way to call people, but obviously that's not going to be possible for the majority of hospitals with the amount of work that you already have. So one thing that some hospitals are looking into is getting some student sort of champions that might be interested in doing patient feedback as part of a project, and see if they're able to utilize that as well. So just really some small ideas that people can run with, really.
That's all for today's episode of IOL in a nutshell. We hope you enjoyed hearing from other healthcare professionals and learned something new. Thank you for listening, and if you have any questions or require any clinical support with Dilapan-S in your hospital, please get in touch with us at dilapan.com. Join us next time and have a great day.